My name is Dr. Quang Henderson. I'm the co-founder and medical director for MindScape Ketamine Infusion therapy. So IV ketamine is used for the last 15 years for various mood disorders. It's been resistant to your normal medication that people have been utilizing for the last 30 years. And so what I mean by that is for major depression, anxiety, OCD, PTSD, and even for individuals that have chronic migraines or even just chronic pain in itself.
My name is Tianna Hall. I am a jazz vocalist here in the Houston area, and I've been a patient here at MindScape since they first opened.
What they've determined is that 30% of people actually become resistant to their current medication. So whenever someone takes medication for their depression, you hear about SSRIs. What they mean by that is they're called serotonin reuptake inhibitors. You have certain neurotransmitters in your brain, serotonin, dopamine, epinephrine, that people take medication to try to make those neurotransmitters more readily available. So how ketamine works is it actually works on the most common neurotransmitter in the brain called glutamate. So by allowing glutamate to be more readily available, it decreases someone's depression greatly. And it's been shown to be effective up to 70% of people even after the first treatment.
I've been a lifelong sufferer of depression since the onset of puberty, and as such, I've also been medicated for depression with SSRIs my entire life since I was about 13 years old. And because of that, I've been through all of the traditional methods, medication-wise, for treatment of depression. I'd gotten to the point where they were becoming ineffective for me.
I would probably say about 80% of our clients that do come in for IV ketamine is for major depression. Again, for those individuals that's been on medication for such a long period of time, they just don't like the side effects of it, or they've been in therapy and they just can't get over that last hump, so to speak, or the last hurdle. And what we found is that with IV ketamine, it's allowed them to get past that hurdle to where they are either able to receive therapy much better, more receptive to it, or that they actually have been able to lessen their dosing of their antidepressants, which in turn lessen the side effects.
When I kept seeing all of these incredible studies on the treatment of depression and anxiety, I kept thinking, well, maybe this might be what I need to pursue. And so when I saw that there was a clinic opening in Houston, I had already been researching options for me to go out of state to pursue this as an option, because I was at the end of my rope and I didn't know what else I could possibly do to find some relief.
So if a client decides that he or she wants to come in for a treatment, we obviously schedule you. You come in, we then put you in a private client room, in which we then have my nurse or myself start an IV on you, which we will utilize obviously for the infusion of the ketamine. We hook you up to cardiac monitors because safety is of paramount to us here at MindScape Ketamine. And so we hook it up to measure your blood pressure, your heart rate, how well you're oxygenating during the 40-minute infusion time. And the dosing is based upon your weight. So we start off at 0.5 milligram per kilo, and then we infuse that over 40 minutes with a computerized syringe pump, which measures and delivers the dosing that's precise for you. And then during that time period, my nurse and I will come in every 15 minutes to revitalize you. That means recheck your vitals again and see how you're doing until the completion of your IV ketamine treatment. The great thing is that during this whole time period, you never lose consciousness. You are fully aware of where you are. You're able to speak, you're able to communicate. And so in that regards, it's a very safe treatment. So we started the ketamine clinic due to the fact that it affected one of my family members that's close to us. And we found that IV ketamine actually helped her, and to where it mitigated her suicidal thoughts. It was that profound for us. And so for me, it was like, there is something that's actually out there that actually works for people. We need to make sure that we put it out there and let people know publicly that this really works. Now, having said that though, what we found is that obviously it has a medical application, but why not create an environment to where it can be almost serene, very zen-like, peaceful, almost spa-like, and that's what we try to create here.
coming here, it's an escape, and in every sense of the word, not just chemically and medically, but it's like going into a high-end spa, like a luxury spa. So you walk in and your sensory input is automatically calmed. For me personally, and everyone's experience from what I understand is very different, but mine has been remarkable in the sense that my first treatment, I said that it was like I'd been walking around with, I don't know, 100 pounds of bricks on my chest, and I didn't even know I was until someone took them off of me. So I came out of that infusion and it was like, oh, this is what normal feels like. It had been so long since I'd had that relief. I'd completely forgotten. I didn't even remember what it felt like anymore. I think the relief that I've gotten, I think it saved my life. I do. And I think it would for a lot of other people too. The first couple of sessions, you typically do close together. And as your brain starts to adjust to the treatment, you don't need as many. It's a long-term effect. I've had great results. I have had to come in for boosters every once in a while, but it's been months now. And when I start to feel things start becoming ineffective for me with my medication, or if I start to have a real low swing of depression, then I'll make an appointment and I'll come by. And all is well again for a long time. I've been able to tackle some things that have given me anxiety my entire life that I didn't think I'd ever be able to tackle. I struggle a great deal with social anxiety, and I used to be morbidly obese. I lost 175 pounds. Now, mind you, I am not that woman anymore aesthetically, but I will always have body dysmorphia in a sense, and I will always feel like I am that woman. I am that woman. That's been a remarkable change for me, to be able to embrace my aesthetic in my current form. And I have to attribute that to the fact that my anxiety is so much more under control. I've also had other friends and colleagues come in for treatment of OCD and also depression, anxiety, as I have, obviously. Another friend that was a trauma victim, PTSD. The list goes on and on. So my recommendations have also gone on and on. Dr. Henderson's an incredible person, and he and his wife both have been such good people and good friends of mine. They're kind and considerate, and through my treatment here, every single consideration has been put in place to make sure that I'm always as comfortable as I can possibly be and as safe as I can possibly be. And I've never had that sort of compassion put into my treatment before. And having that sort of consideration in a doctor is really, it's lovely.